Hi, I'm Dr. Kush Gupta, and I want to thank you for joining me on another episode of Medicine Mentors, where we interview masters in medicine, leading physicians at the top universities across the US to learn from their experiences and derive key insights, traits, and best practices that can guide medical students and residents. Today, we have a very special guest, Dr. Niti Madan. Dr. Madan has had a very illustrious career. She graduated medical school from Punjab University, India, and went on to pursue her residency at Southern Illinois University School of Medicine. She obtained fellowship in nephrology at the University of Texas at Houston, and now is the professor of nephrology at UC Davis Medical Health Center. Thank you, Dr. Madan, for giving us an opportunity to learn from you, to learn more about your life story and experiences.
Thank you, Kush. I'm looking forward to be part of this interview and very excited to talk to you.
So starting off, Dr. Madan, we would like to know a little bit more about you. You've had a career full of successes. We would love to hear your journey from your childhood to current. What were the major events that shaped your success?
From my childhood, I have always been interested to become a physician. And my parents, my mom, dad, they were always telling me from my childhood that once you grow up, you have to become a doctor. So from day one, when I started having this concept of I have to be a doctor. So my career was shaped into that to become a doctor. So I did my MBBS from Punjab Medical College, and it's in Patiala. And after I finished my MBBS, I worked in a small town to help poor people and did my year and a half of job over there where I used to drive and help poor people who did not have access to medicine. After that, I got married and came to US. My husband is a physician and I was in Illinois. Then I went to Southern Illinois University where my husband did his fellowship in gastroenterology and I did my internal medicine residency. And I think that started the interesting path. I loved my residency over there and I feel like I got a really good mentors which helped me shaping my career. And Dr. Hingle at Southern Illinois University was my mentor. And I was very fortunate to have her guide me and stimulate me. And then she was somebody I really looked upon and wanted to follow her path. So I finished my residency at Southern Illinois University. I was chief in my last year. And then I joined a family practice program as an internal medicine faculty in Kentucky because my husband was working in a smaller town and that was the only academic program available because I always wanted to be in academics. That was my career path I chose while doing my residency, that I want to go in academics. And during that academic year of my job, I decided that I want to do a fellowship and applied for fellowship at University of Texas and was supposed to start in July, but they offered me to start in January. So my fellowship started early and I started nephrology and it was quite an interesting experience, very busy and very, very nice fellowship, very great training program. And I got another mentor, actually I would say maybe one or two mentors in Texas who guided me and who made me realize all my potentials. So here I am, applied at University of California. And that was my first job, my first academic job. I would say that I always wanted to be academician. And between my fellowship and my job, there were a few months where I didn't want to take any job until I get academic job. So I just stayed persistent and I just did some locum few months and no commitment job. And then this job opened and I grabbed it. And I was very fortunate to get this opportunity and I love being at UC Davis. So that's my career. I did not know that I'll be in US. I did not know I'll be in academics. I only knew that I want to be a doctor.
So can you talk a little bit more about your upbringing and what critical values you embodied at that time in the environment that you were brought up in?
My dad worked in a pharmaceutical company where he met a lot of doctors and he had a lot of work-related exposure to physicians, and then he has a lot of friends who were physicians. So I think that made him really interested for his children to become physician. So he, as much as I remember from the school time, I always heard from him that you should go into medicine. It's a great profession. It's a noble profession. You can do so much of difference to somebody's life. You can impact them. And then I have a younger sister. He wanted her to become a physician as well, but she actually went into clinical psychology. Growing up in India, you see that a lot of people don't have access to medicine. That made me get interested in medicine. And then I think having my mom have some blood pressure, hypertension issues,
Right.
seeing her having those issues of high blood pressure. So those health issues, and then my dad and mom passion to me to become a doctor. I think that just made me keep my path focused. I wanted to be a pediatrician when I was young. So it's interesting. I changed my interest to internal medicine just because I could not see sick kids. I just felt like it will be hard for me to see them all the time being sick. I didn't really realize that I want to be a teacher because right now I'm a teaching physician and I never thought I'd be in a teaching profession. So
Right.
I think this is a great combination where I can work with young students and young residents, and I can be their mentor and I can tell them, guide them how to shape their career. So this is a perfect combination of being a teaching physician where you can teach and also treat the patients.
You mentioned how you had a few mentors in your life who helped you in your career path. Can you talk to us a little bit more about your experience? You mentioned Dr. Hingle. Can you talk to us a little bit more about how you interacted with her? What role did she play in your personal and professional growth?
I would say that a good mentor is somebody who's very approachable and who understands you. Sometimes as a person, you might not know your potential, but your mentor can identify that potential for you and tell you that you are good at this. You might want to get better at these things and get better at those things. So Dr. Hingle, she just inspired me so much as a woman in medicine. And I actually saw her, admired her, that how well she managed her family life and her work life. She's a great mom, great wife, and then she's a great physician and a great teacher. So
Right.
those things I acquired, I wanted to just become like her. And she's a very approachable person. I think a mentor needs to be very approachable and also have a very good way to give feedback to their students and resident and fellows. So she used to give feedbacks, positive and then negative, in a very nice way that you would learn from those feedbacks and want to get better in certain those areas. So I had a great mentor as Dr. Hingle, and then I had a great mentor, Dr. Dosikan, as my fellowship. And along with him, Dr. Finkel, Dr. Foringer, there were other attendings, which I would say that you don't need to have one mentor. You can have multiple mentors. Everybody has
Right.
things to offer. I think the main thing from mentor should be that somebody you can just reach them anytime when you need help. So at this time, whenever I am in a situation where I want advice or I want just to make sure that I'm doing the right thing for my patient, I will just pick up my phone and call my mentor. And it doesn't matter what time it is, they will be available to help me out.
So, another thing that I want to ask you is, have you always been so successful? You mentioned how there were key moments in your life when you made the decision. You wanted to go into pediatrics in the beginning, then you went into internal medicine. You had not imagined that you would come to USA and practice here. So, was there a moment of decision in your life, or rather say moments of decision in your life, which was a turning point for you?
I've always wanted to be in India, and that was my first decision to come here and start my career over here. It was a very turning point for me, and I was not that excited in the beginning, but as the time went on, I just loved what I chose. I first felt like maybe I made a wrong decision and I should have not come here because I was in the right path in India when I was helping out. And once I started my residency at Southern Illinois University, I think that was really something which made me start enjoying my profession even more. Over there, they had a very balanced teaching, learning, and clinical exposure over there, clinical work.
Right.
So they kept a very good balance of learning environment. And I just enjoyed the learning part, the how you learn and then you practice your medicine. So in India, it was like more into reading and different skills. Over here, it was like what you read and then you apply that on your patient population. So those were the key differences in my learning experience in India versus in United States. I will tell you that I started my nephrology fellowship and I had a 2 months old baby, and I was
Okay.
really, really overwhelmed at that time. And I
Right.
was like, I want to leave my fellowship in between because I could not handle the stress of too many demanding areas I was. But my husband and my parents really supported me that time, and they wanted me to stick to what I have picked. And I'm so thankful that having support from your family and your friends, that made me keep going with it. And I finished my fellowship and I loved it. I'm so glad I continued doing what I was doing.
As I researched, there are very few people in allopathic care who take into account the importance of mindfulness in providing healthcare. I found out you are a strong proponent of meditation and mindfulness as an adjunct therapy for your patients. Can you expand on that?
So I have seen my mom practicing meditation for last 10 to 15 years. She has health issues, but she stays very happy. And I cannot really understand how she can stay so happy with so many health issues. I think the time she gives to herself in the meditation time, that makes her very strong individual. I admire how she can stay positive and stay happy amidst of her health issues. So that is what I think made me get excited and get interested, because I've always seen her as a strong individual. And then my sister, she's a psychologist, clinical psychologist. So their patients do these things. And then I wanted to learn more about it. And then we have another nurse over here. She is a strong proponent of meditation. So all these three individuals I have come contact with, I have learned so much about meditation and positivity in life. So that really made me start feeling like, there's something which is very important in your health, not only taking your medicines, sticking to your doctor visits, but there's something which you need to be strong and feel good about yourself.
So out of all the things you told me, what is the one thing that I can take away from this interview and start enacting or start using in my life as a aspiring physician, as a young student in medicine?
I would say that there are a lot of different things which makes us a strong individual. But I strongly feel like whatever you pick in your life, you need to really show your best in that area. You need to put all your potential in whatever you picked and show that this was the right thing you chose. And then the person who chose you made a right decision. So give your 100% in whatever area you go to. You might change your career. You might want to become cardiologist right now and you might become into a different specialty. That's totally fine. But whatever you are doing right now is what we need to make best at that time. And be honest to your commitments. Along with that goes a lot of things like being persistent, timeliness, being organized. You have to make sure that you have to get your things done in a timely fashion because you don't want to really disrespect somebody else's time.
Thank you, Dr. Madan. I'm taking away a few critical insights from this interview, which I think will help me become a better student and a mentor down the line. One of the things that you talked about was being persistent, how you were so persistent in pursuing your goal of becoming an academician, becoming a mentor, and having been involved in resident and medical student education throughout your career. And then choosing the right mentor, and most importantly, being committed. Be very honest with your commitments, with your mentors or to your patients, or even with yourself, and be available to your mentors and to your patients. And amongst all, so many things that we talked about, staying positive in life, being mindful of the things that you do, being mindful of the people around you, that is when being positive yourself will help us in helping our patients see the positivity in life and bringing out the best of the treatment results that we try to provide them.
I just want to add one more thing is that I deal with a lot of sick people, like people going on dialysis.
Right.
And people like having no hope. They think that this is end of life when they go on dialysis. I think it's so important for them to know, for us to tell them that this is not end of life. There is always a hope in whatever issues or health issues or stress in the life is. There's always a positive thing that we can probably bring to their focus so that they can have some positivity and some hope in their life. I think you summarize it very well, and I wish you the best in your career, and we would love to see you as a great mentor.
Thank you very much, Dr. Madan. To our audience, thank you for tuning in with us here on the Medicine Mentors. Thank you for joining us as we learn from the Masters of Medicine. Stay tuned.